Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss the axilla. In the last class we have completed pectoral region, the muscles in the pectoral region, the fascia covering pectoral region, and more importantly the breast. The breast is covered in two parts. If you did not watch, please go watch it. And today we are going to start the axilla. Yes, in this lecture we will complete boundaries of axilla, where it is presented, and the contents of axilla. Yes, axilla is also known as armpit. Yes, it is also known as armpit. It is presented it is extended between the chest wall, and upper part of the arm. Yes, this is the arm, right? The upper part of the arm and the chest wall. In between is known as axilla. Yes, axilla, it is a pyramidal shape. Yes, it is a pyramid shape containing apex, base and four walls. Let's see the description of axilla. See, axilla is very important question. It may be asked for a long answer. Yes, and axilla, it is also known as armpit. It is a pyramidal shape. Presented between chest wall and upper part of the arm. Yes, it is presented between chest wall and the upper part of the arm. It is bounded by axillary fold. Yes, it is bounded by axillary fold. Anteriorly by anterior axillary fold. Posteriorly by posterior axillary fold. Yes, it contains structure passing from neck to upper limb. Yes, it contains the structure passing from the neck to upper limb. As axillary artery, brachial plexus. Yes, there are some structures which are extending down to upwards, like upper limb to axilla to neck. Yes, example axillary vein which go in the opposite direction. Yes, now let's see the boundaries of axilla. As I said, axilla is pyramidal shape. It contains an apex, a base also known as floor, and four walls: anterior, posterior, medial and lateral walls. Yes, let's see the apex. It is also known as cervico-axillary canal. Why? Cervical means what? Neck. Axillary, it is extending between neck and the axilla. Yes, so this cervico-axillary canal directed upward. Yes, it is presented directed upward and medially into the root of neck, containing axillary artery and brachial plexus. Yes, these two structures, axillary artery and brachial plexus, are passed from neck to upper limb through cervico-axillary canal, hence named. But the axillary vein is from down to upwards in the opposite direction to the axillary artery. Yes, let's see the base. Base is also known as floor. Yes, the floor is formed by axillary fascia. Yes, the floor is formed by axillary fascia. It is lower end of axilla, directed downwards. Yes, whereas apex directed upward, base directed downwards. It is bounded anteriorly by anterior axillary fold formed by lower border of pectoralis major. Yes, and it is bounded posteriorly by posterior axillary fold. It is formed by latissimus dorsi and teres major. Yes, and now anterior wall is formed by three major muscles: pectoralis major, subclavius and pectoralis minor. These three muscles together forms anterior wall of the axilla. And now posterior wall is also formed by three major muscles: subclavius is presented in the costal surface of the scapula, latissimus dorsi, which is the broad muscles in the back, and teres major. These three muscles together form the posterior wall. And now medial wall. The medial wall is formed by upper 4 to 5 ribs with their corresponding intercostal spaces. Yes, with corresponding intercostal spaces and covered by serratus anterior. Covered by serratus anterior muscle. Yes, forming medial wall. Now the lateral wall is formed by tendon of biceps, coracobrachialis, and short head of biceps brachii. Biceps brachii containing two heads, long head and the short head. So the tendon of biceps brachii, short head of biceps brachii, and coracobrachialis all together forming lateral wall. So the lateral wall is very narrow compared to other. Why? It is bounded by axillary folds anteriorly and posteriorly by axillary folds. And what are the contents of the axilla? Yes, the main content of the axilla are axillary artery and axillary vein, brachial plexus, axillary lymph nodes. Yes, these are the main contents of the axilla. Axillary artery, its branches, axillary vein and its tributaries, brachial plexus with cords. There are roots, cords and branches of brachial plexus. So in the axilla we contain cords of brachial plexus and axillary lymph nodes. Yes, along with them fibro-fatty tissue, axillary tail of breast. Axillary tail of breast is the extended part of the breast into the axilla. Yes, long thoracic nerve. It is a branch of brachial plexus and intercosto-brachial nerve. Yes, these are the contents of the axilla. See, as I said, it is a pyramidal shape. Yes, it is a pyramidal shape containing apex and base and four walls. Yes, so apex is directed upwards. Yes, the base is directed downwards. The base is formed by what? Fascia. It is formed by fascia directed downwards. Yes, this is axilla and its contents. If you have any doubts, please do comment in the comment section. Please do like the video and do support and subscribe the channel. Thank you.